And we're off. Good afternoon, everybody, and thank you for joining us on this wonderful Tuesday afternoon. It's actually the last day of November, which I cannot understand. Where did the rest of this year go? Tomorrow is December. But before that happens, we have so much information to share with you today. Today, we've got a couple panelists lined up for you from Houston, from the for the Homeless of Houston. We have Anna Rausch, who's the vice president of the let me get that right. Vice President of the Program Operations, as well as James Gonzalez, who's the Director of Programs Operations. They're going to be going over Houston's encampment policy and kind of what that looked like in their community. Before we begin, I do want to let you know today's session is going to be recorded for you to review later. Your mics and cameras have been disabled. I want us to focus on the presenter's information, but please, please, please interact in our chat pod. We do have a couple surprise polls for you, so be on your toes for those, and we're going to want to see your answers. And without further ado, let's slide into our presentation room and let's all learn something, y'all.
Good afternoon, everyone. Thanks for having us. We're very excited to be here. As he said, my name is Anna Rausch, and we're going to talk a little bit about some things that are happening in Houston. This article that you see here in front of you was an article in the Houston, actually in the Monitor, and we can share the link later, but this was one of the encampments that we were decommissioning early on in the very beginning. A little bit about the coalition. We are the lead agency for the TX 700 Continuum of Care. We're also the HMIS lead and the coordinated entry lead. This is our mission. We do all things data and all things housing, as you know, and all things COC lead that needs to happen in our continuum of care, which encompasses 3 counties, Harris, Fort Bend, and Montgomery. The Way Home Continuum of Care is it's just another name that we call the Texas 700 COC. We don't like to say Texas 700, and so we basically just renamed it. It is the collaborative model to end homelessness in our continuum of care. We have more than 100 stakeholders to help us do this. Since 2011, we've reduced homelessness by 54%. We've housed over 22,000 people, and we have about an 85% success rate in housing placements. A little bit about the size of our geography. We, at those 3 counties, you know, we're the 4th largest city in the U.S., as you all know. We have 3,700 square miles in our continuum of care, which is those 3 counties that I mentioned. However, what you see in front of you is only for Houston and Harris County. So we are as big as 4.5 Grand Canyons. We are as big as 2.5 Yellowstone National Parks. We are as big as that many San Francisco bridges. And because I'm a huge Disney fan, this is how many Walt Disney Worlds would fit into our entire region of Houston and Harris County. However, if you want to bring up that poll real quick, Craig, is it on here? I can't even see. Yes. Name some cities that can fit inside Harris County's Grand Parkway. If you're familiar with our continuum of care, we have the 610 Loop, which is kind of like the center of the city, the core of Houston. And then right outside that, we have Beltway 8, which is kind of going towards the suburbs of Houston, and it makes a circle around all of our region. And then most recently, over the past several years, we have several big projects, including the Grand Parkway, which kind of goes even further around Houston and Harris County, and sometimes even into some of the outlying counties. So I want to see if anybody knows the answer to this. Anyone?
I think they're scared. Come on, somebody answer.
Well, I can say that Paris will fit inside the Grand Parkway. Rome will fit inside the Grand Parkway. Austin and San Antonio will fit inside the Grand Parkway. Washington and the surrounding areas together, Washington, D.C. will fit inside the Grand Parkway. So that's just to get you an idea of how big our continuum of care is. So it's very, very, very huge, which is challenging at times. So. Alrighty, our point in time count in 2021, we did do an unsheltered and a sheltered count. We did a full count in 2021, taking advantage of some of the waivers to do it a little bit over during the day for the unsheltered count and conducting interviews So this is the number that we came up with. It was 3,055 individuals. Of those, 1,400 were sheltered in Harris County. Almost the exact same, 1,400 were unsheltered in Harris County. For Montgomery County, the sheltered number was 58. The unsheltered number was 44. And then for Fort Bend County, the sheltered number was 48 and the unsheltered number was 12. So we've been doing a lot over the last several years as far as, housing and encampment decommissioning and unsheltered homelessness. And of course we can't really compare this year's homeless count with prior years because we did change a little bit of the methodology. But we believe that the PIC count does suggest that a housing focused pandemic response kept the numbers down. And I'm going to talk a little bit about what that was. From October 1st, 2020, when our big project, our COVID housing program started, through January 19th, which was the night of the homeless count, almost 800 people were permanently housed. 58% of individuals housed through this program were living unsheltered prior to being housed. 1 in 7 experiencing homelessness cited the coronavirus as a reason for their homelessness. And then we also believe that the ongoing eviction moratorium likely prevented a lot of people in the region from falling into homelessness. So over to the right, you see that, our numbers, our homeless count has gone down significantly since 2011. And then you can see compared to other cities where we land. So even though we had done quite a bit to end homelessness, we'd seen a steady decline in our homeless numbers until 2018 when that big monster hit us, Hurricane Harvey. That year, 18% of the unsheltered indicated being homeless as a direct result of the hurricane, which devastated our region in 2017, as many of you know, in many areas of Texas as well. And then additionally, after the hurricane, much of the homelessness response system was redeployed to help respond to the disaster and help house all of the individuals out of the disaster shelters. And so the reason for the decline was because really our COC invested heavily into permanent housing, including securing a lot of the COC bonus funding over the years. But really after 2019, this influx kind of went down a little bit. We slowed down, and so we're relying only on turnover availability for both permanent supportive housing and rapid rehousing. We don't have a lot of shelter in our continuum of care. We put most of it into permanent housing. And then according to the epidemiologist that completes our homeless count report, the percentage difference that we've experienced over the last few years in the homeless count is not statistically relevant or significant, I should say. And so we really, because we haven't had a lot of resources or influx in new permanent housing, our numbers have remained a little bit stagnant. Am I supposed to do something with that bell? Sorry. Okay.
So I'm sorry, that was the conference line. It's somebody died.
Oh, okay, gotcha. Okay, sorry about that. So we, as you can see, we've housed quite a few people. We've reduced our homeless numbers by almost 60%. From 8,500 to the 3,500 that I mentioned, but it's stayed around the same over the last few years. So we really needed something to get over that hump and really make a dent in our homeless numbers. Oops, I went too far.
You have been muted.
Another thing that happened over, am I muted? Okay. Another thing that happened in the fall of 2019, Harris County put together a homeless task force to really look at the picture of homelessness in Harris County and figure out where we needed to invest. It was heavily influenced by the visible homeless population, so all of the people living unsheltered. The task force put together a report on how much homelessness costs taxpayers each year. So you can see that the cost of homelessness that came out of that report was $96,000 per year. And then the cost of supportive housing is under $20,000 per year. So this would be a savings of about $76,000 per year per person for to house people instead of letting them remain homeless. And all of this was, shelter stays, ER visits, jail stays, all of those things that cost taxpayers a lot of money. And so this report was very valuable and really showing the community how much it was costing and how much it would save if we would just invest more into permanent housing. And as a result of this report, we actually for the first time received general revenue dollars from Harris County, where we'd never been able to do that before, which of course we immediately put back into permanent housing. So then, the pandemic happened. We had all of this CARES money coming into the community. And so we went to our city and county funders to create this community COVID-19 housing program. So on July the 1st, 2020, we announced the plan to serve 5,000 people by October of 2022 with $65 million. We were already in the middle of a comprehensive strategic planning, 5-year strategic planning process when this happened. And so we wanted to pick up where that left off. When COVID hit, we were really in a better position to respond to the disaster because we were in the middle of that 5-year strategic planning process. It was really an opportunity to create a disaster response that was more holistic and part of a broader strategy instead of just putting the money to plug holes and use it as a Band-Aid. The funding that came through due to the pandemic really presented us with a historic opportunity to really make a huge dent in our homeless numbers because we knew that our community's most marginalized and people are at the greatest risk of the negative health impact of COVID. And so we wanted to make sure we house people as quickly as possible with this housing is healthcare mentality. And so we are happy to say that the budget was approved in Harris County and the city. We had a unanimous vote in Commissioner's Court, which is really unheard of prior to that. So it kicked off on October 1st of 2020. So then really because of the strategy for CHIP, Community COVID-19 Housing Program, aka CHIP, so you hear me say that a lot. The plan for CHIP was to put a lot of the funding into permanent supportive housing by using rapid rehousing as a bridge. We have about 5,000 PSH in our continuum of care that turn over at about 40 to 50 a month. And while clients are waiting on that turnover PSH slot, as a lot of you know, they're waiting on the streets or in emergency shelters. So we wanted to use some of that funding as a bridge to permanent supportive housing and house people immediately so that over the next 2 years, as that PSH slot became available, we would roll them over into that slot and exit them from the bridge. So this was going to serve about 1,000 people in the 2-year period of CHIP. We also wanted to serve 1,700 people experiencing homelessness with 12 months of rapid rehousing. This was for those individuals experiencing homelessness due to the pandemic. We modified a lot of our coordinated entry questions to capture those individuals. And then the last thing that we did was diversion, which was brand new to our continuum of care. We wanted to look at those individuals that were really on the cusp of the homelessness response system, and we wanted to prevent them from becoming homeless. We also used some of the money for some auxiliary sheltering so that we could decompress some of our existing shelters. And so really
Your microphone has been turned on.
that broke out, this is what the funding breakdown was for all of the $65 million. We had about 40 million that came out of the city, and this was the funding breakdown for that. And then the 18 million that came from the county, and that's the funding breakdown that you see there in front of you. And then we had to raise about $8 million for private funds because there were some things that, as we knew at the time, the government funding would not cover. So we wanted to do some landlord incentive, which I'll talk about a little bit. And then we also wanted to do furniture and some expand outreach. And we wanted to make sure that our partners that we were going to recruit for this endeavor were able to keep the admin. So some of the admin dollars did not come to the coalition. We used private funding for that. And so I'm happy to say that, oops, one of the slides didn't come through. Let me see.
Hello?
One of the slides didn't come through. So what I can say, we can fix that when we send these out, but this slide is supposed to show the number of people that we have served through CHIP. So remember I said that this right here, we were going to serve 5,000 people by October of 2022 with these interventions. And I can say that the first year anniversary of CHIP was October 1st of 2021, excuse me. And we've actually surpassed the 2-year goal in that first year. We've served 6,406 people with CHIP since it started on October 1st. So it's been a tremendous amount of work, and really without CHIP, the CHIP investment, we wouldn't have been able to house a fraction of these individuals that are living unsheltered and creating some of those visible negative image of the homeless response system. So why are we targeting encampments? Well, we had the additional resources, so we knew that we could do this. We tried it on a smaller scale. One of the documents that we shared was an article that was written way back in, I guess it was 2018, when we closed our very first encampment. Some of the challenges that we faced and some of the things that we needed. We can't close an encampment unless there are housing resources available and outreach. And so, of course, all of those resources were available through CHIP. We had, the living conditions of people living in encampments are not the best, as we know. There's visible and public opinion, so a lot of complaints from our commissioners, a lot of complaints from the mayor's office, a lot of complaints from the community about what we're doing for the encampment. Individuals living unsheltered are at greater risk of COVID exposure. And then, of course, if we know the people that are residing in these locations, then we can better target them for services. So really, CHIP allowed for the rollout of an encampment decommissioning program that has demonstrated proven results in placing individuals living on the streets into housing. Thus far, we've housed 124 people through the encampment decommissioning process. These are the different locations, and my coworker James is going to talk a little bit more about them. But we've decommissioned 10 encampments in the past year. Very few individuals refuse housing through the encampment response strategy that we have. Because we got some technical assistance from HUD for the pandemic, for the CARES funding that came into the community, we also worked with him to develop this encampment response strategy. That was a request of HUD, and it has gone out and is being used on a national scale at this point by many cities. And then it allowed for the implementation of a temporary navigation center and then ultimately a permanent one sometime next year. So I'm going to turn it over to my coworker James to talk a little bit about the actual decommissioning of all of the different encampments. Go ahead, James.
Hi, everyone. So, as Anna mentioned, we've been doing this whole encampment process for some time now. We've finally got down to a rhythm, so to speak, kind of based on the resources we have coming in. So just to give you a little bit more information on what that process looks like, we've broken down encampments into 3 sizes. That's really based on the number of people, the amount of structures that are there that people are using for shelter, and other items around like trash that give us a sense of a sustained presence in the area. For some further classifications that we've put together when identifying encampments is 5 categories. So location characteristics, vulnerability of population, environmental, community safety, and solid waste. Each category has vulnerabilities that our community has identified. And some of those examples are number of people there, physical or behavioral health concerns, violence in the area, if this camp is close to flash flood areas, and excessive loose garbage and trash that could be a health hazard. So the site identification and reconnaissance process has been a bit interesting and has kind of been fun. You get to use your detective skills to find out more about the area and the clients, to really get into those characteristics. We spend about 4 to 6 weeks to get familiar with the area, and this includes getting familiar with the businesses nearby, staff who've been at those businesses nearby for hopefully more than a year or so, and can really give us some homeless documentation for clients who are staying in the area. You get a sense of safety concerns. You talk to different community groups, law enforcement, elected officials that cover those areas. So kind of an in-depth assessment of the camp we do is to make sure that we know what resources and support services are needed to successfully decommission the encampment. And this also allows us to put together a timeline based on those needs so that all the parties can be notified and know what to expect leading up to the encampment decommissioning. we the kind of the most important thing we do with all of these is create a client by name list. This list is kind of our centralized uh, source on what resources we need based on how many people are on it, how many housing providers need to be involved based on how many clients are on it, and what different kinds of housing interventions need to be involved based on the vulnerability of those clients.
Sorry.
Yep.
Can you go back? Um, I wanted to mention one of the things that we've learned. I know we're going to talk about that, but when we were first doing this back in 2018 and then 2019, we found that if we did not have a by name list and then we set that by name list by a specific date, then it could potentially, if anybody came into the encampment after we had set that deadline, then we wouldn't know who we had maybe interacted with prior. So it's really important that you create that by name list and determine who needs what, and that you stick to that, so that if the population is artificially inflated because whatever reason word got out, then you need to make sure that you know who needs to go where, and then if at the end there's room for additional individuals, then you can do it at that time. Sorry, James, go ahead.
No, thank you for mentioning that. Many encampment locations, the nature of those areas is so transient. So we oftentimes have to talk to clients about, do you live here or are you passing through and periodically staying here? Uh, Based on the kind of housing options available, and like Anna said, how the numbers can fluctuate in and out of these areas, it's really important to determine who's actually living there long term and who just kind of comes in periodically, either because they know people who stay there or they're wanting a resource that's at. All right, so encampment response 2 weeks prior, our outreach team continues to do the engagement, really nailing down those documents that are needed. Our landlord engagement team works on trying to identify units for clients. Now, all of that is tied to the client list. That client by name list tells us how many people we need, and we get permission from the clients to do a check of their background, not for eligibility to a program, but to line up properties that will accept them based on their criminal or rental history background barriers. So the landlord team is kind of in full force trying to identify X amount of units that will meet the needs for the clients who are staying at that location. Then, of course, at that time, we're also confirming with solid waste and Metro to clear out the area when, as we're done, and to relocate clients to their new home. 1 week prior, this is like you're in almost the home stretch. We're finalizing the list, finalizing resources needed, lining up briefings with providers to talk about what those needs are, what's expected of them, and then outreach teams begin to kind of communicate to clients in that area that encampment will most likely be closing soon. Up until this point, we are communicating that we're just doing outreach and that we want to connect folks to housing. So we're doing assessments and just regular outreach activities. So it's not until this week before that we actually start telling them that this is something we believe is going to happen. The actual week of the surge, the law enforcement will put out a notice saying that the encampment has to be closed and cleared by a certain date and time. We are not a part of that process, but we do work with law enforcement in identifying which dates and times to do that. And all that, again, is based on our planning the weeks before, determining how long we're going to need to get folks out of the encampments and into housing. Something that is very important for this week in particular that we've learned through trial and error is that everyone has to be on site. Every single part of the boxes you're seeing on the screen here have to be on site. That's housing case managers, landlord engagement teams, outreach workers, our hot teams, Metro, everybody has to be on site. Otherwise, things just fall through the cracks. You've got outreach teams helping clients sort through the things they want to keep, the things they want to put in storage, and the things they want to release and let go of. Housing providers are enrolling clients into programs and having them, review a list of apartments that will accept them given their criminal and rental history. And they're doing those housing applications. You got the landlord teams coordinating with all the different properties, making sure units and leases are going to be ready that day or that week. And then, law enforcement is out there with support as well as solid waste, cleaning up as we go and helping transport items to storage. Aftercare. This is just as important as all the other work that was done previous to the surge. It is so important that these clients are having a ton of contact with support services the day they move in. So whether it's PSH or rapid rehousing, we found that it's very important to have daily contact with folks, at least while they get acclimated to being at their location. Then outreach continues to engage with folks in that area. Just because the camp is closed doesn't mean you don't have periodic people going through who are panhandling or who are maybe newly homeless. One of the most important things about the aftercare part, however, is the law enforcement. So part of kind of the city and county's commitment to this process is they provide law enforcement that continues to make sure that nobody is camping in that area. Once you have one or two people camping in an area again, then it just completely backfills. So that is definitely key. A couple lessons learned. Our city has tried giving tickets to folks saying, you can't stay here. We've seen that does not really deter behavior. Active warrants don't really deter behavior. In fact, it just makes it more difficult for our outreach teams to get documents for our clients to get into housing. When we set up for these encampment decommissionings, like I said, being on site is imperative, as well as the location you pick. You want a spot that is going to, not increase foot traffic to your area. You don't want to be out in the middle of, an HEB parking lot, because that will just draw further attention to you. Typically, we're set up with tents and chairs and tables, and so people are naturally curious and want to come up. So it's important to pick a spot that, so that you're off to the side somewhere. And then, of course, strategically using law enforcement. Sometimes, given the areas, there might be safety concerns, but you also don't want law enforcement there in full force, because they could scare off some clients who you are trying to get into housing. These are just a few examples of some of the large encampments that we've decommissioned. And then we have pictures of some of these as well. And these are some of the small.
I wanted to answer one of the questions verbally. So the question is, do you have teams in your outreach? So one of the great things that we did with some of the CARES money is to beef up our Harris Center for Mental Health, formerly MHMRA. We beefed up their behavioral response teams to work with individuals that we are housing. And now we have them that they come out with us on encampment decommissioning. James, you want to talk a little bit about what they help with?
Yeah, as Anna said, if it wasn't for the CARES funds, we wouldn't be able to do this, but they actually have 3 different teams that they've been able to put together. So we have a team that is on the ground at these encampment decommissionings with our outreach teams. We have another team who is operating out of our temporary navigation center, where folks now, when we close or decommission an encampment, folks are sent to the temporary navigation center if we don't have housing lined up immediately. And then they have a third team that works with all of our housed clients. So, really, at each point that clients are either touched through this process or in our housing programs, they're able to use those resources. And we're actually kind of rebranding what we call them because mental health and behavioral health really kind of has stigma attached to it, and it really kind of discourages some clients from wanting to engage. So we've kind of rebranded them as a wellness team. They're there to provide supportive services, and we kind of just incorporate it as just a kind of another element of our program. Just like in rapid rehousing, you may talk about budgeting. Well, we also talk about wellness teams. And we, highly encourage those referrals. And we, they do services around not just mental health crisis, but they're going to offer counseling in this next year. They provide domestic violence support services, substance use services, and they're working out how to kind of have our own emergency crisis response services connected to these funds as well. So we've been very, very lucky. And I think that's you.
Of people that take part of an encampment decommissioning process. We're very, very fortunate that we have a lot of support from both the city and the county. They both have homeless outreach teams. The sheriff's department has homeless outreach teams. The city has homeless outreach teams. And so all of these individuals, as well as Metro for transportation, solid waste. During COVID, we've had some COVID cleanup crews. And then we have all of our outreach and housing partners. So any housing partner that has an open slot that we have referred through the coordinated entry process come out to the encampment, and they enroll the clients on site. They gather all the necessary paperwork. So it's really a community or a partner process. It's not just the Coalition for the Homeless, although we do lead this. It makes sense for the lead agency to kind of guide the process because we're the ones that reach out to the local officials. We're the ones that coordinate with the various management districts or neighborhood groups if there are any. And so we don't have sanctioned encampments in Houston. And so it's really important that we work together to address them. Both our outreach teams for the sheriff and the HPD, Houston Police Department, they are trained in HMIS. They do coordinated access assessments. We call it coordinated access. It's coordinated entry assessments. And so they do use HMIS. They're able to assess clients on the spot. They're able to look and see if they have a referral. And then they're able to look and see where they are on the wait list, and et cetera, et cetera. So I'm going to talk a little bit about the landlord engagement piece, which is so important. We learned through after Harvey, as I mentioned earlier, that how important it was to work with landlords to recruit units. And so when we were tasked with decommissioning, they don't have limited access. They have, this is going back to the homeless outreach teams for the sheriffs and HPD. They do not have limited access. They have full access in coordinated access. They can see where clients are. They are not punitive, so they don't use this for the purpose of arrests or anything of that nature. We trust our homeless outreach teams for both the city and the county. They work very closely with us. They work very closely with our outreach teams. And so they only use HMIS for the purpose of connecting individuals to housing. They even help us with what we call hot IDs. A lot of clients, as you know, don't have IDs. And so they're able to print out little quasi IDs, I guess, with the client's picture and their name and date of birth, and we can use those to actually get them a permanent ID and Social Security. So yes, we're very fortunate. And so talking about landlord engagement, after Hurricane Harvey, when we were tasked with housing people out of the disaster shelters, at the time, the mayor and the apartment association president put out a call for landlords to, you know, to put forth units to house people out of the disaster shelter. And so we got about 3,000 units at the time, market rate units, apartments. And we had so many, we were able to house the people from the shelter pretty quickly within about 40 days. And so we thought, okay, if we can do this with that, then we can do it for the homeless population as well. And so we hired a landlord engagement manager right after Hurricane Harvey to kind of start this process with the Coalition for the Homeless. And so once we got the CARES funding, we actually beefed up that staff, and now we've even beefed them up more because it has gone so, I mean, it's just really exploded into this big, wonderful thing. And so the landlord engagement team is really focused on recruiting efforts. So really all they do is they network with landlords to recruit units for our process. And so they're like the case managers for the landlords. So they're the front facing person for the system on behalf of the landlord. So if there are any issues with clients, the landlords go to them first, and they work with the landlords to kind of orient them on what the process is. And what all the program entails. And so really they recruit and engage with landlords. They target affordable housing properties with high vacancy rates. They secure those market rate units that meet the FMR guidelines and that will pass HQS inspections. They develop the standardized landlord agreement and contracts that meets all the needs of all the funding streams. They actively coordinate and keep accurate inventory, and then they distribute the landlord incentive fees, which I will talk about in a minute. So these are all of the things that the landlord engagement team does. So basically, they go out and they, if a landlord has X number of units, they say, okay, we have a housing program available. We want to house people that are homeless. So would you be willing to dedicate X number of units towards our whatever permanent housing or rapid rehousing program we have in place? Here's what it entails. And so we talk about that these individuals are going to have case management, that they're not going to just be dropped in a unit and be left alone. If there are any issues, that we will be there to intervene. And then in return for all of that, we will pay a landlord incentive fee. So I don't know if I went through this too fast, but these are some of the things that they do. And so what the landlord incentive fees do is basically it allows for us to bypass, it's in lieu of a deposit, it's in lieu of an application fee. So in other words, they receive $1,600 per unit that they dedicate to our project, to the homelessness response system. And so if that means that we get to determine, they'll tell us, okay, we'll take anybody with any criminal background, with any criminal or credit history, with any evictions on their record, but we draw the line at sex offenders. And so we know we can't house sex offenders with these properties. But then they agree to waive the criminal background. They agree to not charge deposits or 3 times the deposit because someone has evictions on their records. And so really the individual doesn't have to go out and search with a navigator or with a case manager to various properties and search for units. We just have a list of available inventory, and we provide the client with all of the available options and say, here's what you have. Now, obviously the client says, no, I don't want any of those. I want to pick my own. They can do that. It's not you have to do this, but everyone is eligible to receive this landlord engagement fee. We do have a landlord engagement packet. Let me see. We may have it on our website. If not, I will email it out to Texas Homeless Network so they can post it on their website with these slides. And so, is it a one-time payment for a lease? Yes. So it's one-time payment. So if they have, let's say one landlord has 20 units and they're dedicating that they're dedicating to us. So we pay 20 times 1,600 every time someone moves in. So it doesn't matter if it's, if that unit turns over 5 times, they get to keep the $1,600 and we will pay them a landlord incentive fee again. That's correct, right, James? Did I say that wrong? Yeah, that's right. Initially, we used private dollars for this, and so we were able to do when we did at the very beginning of the pandemic. I want to say it was like in July of last year, or maybe in May of last year. We presented this landlord engagement in all of CHIP during the HUD office hours, the SNAPS office hours. And then there was so much, community response about landlord engagement fees that shortly after that, HUD put out the notice that ESG CV dollars could be used for this landlord engagement process, so they could pay the landlord incentive fees. But for the most part, we've been using private dollars to pay for this. But we know that, ESG CV funds are available to pay this. One of the things that's been fantastic, not just for CHIP, but the landlord engagement process itself. So we've been able to reduce the amount of time that people have been housed, but we've also housed more people in the past year of CHIP, 3,845 people that we've housed in both rapid rehousing and permanent supportive housing, as almost the past 2 years combined of regular turnover, not COVID funding. And then more than the 2 years prior to that. So you can see the number of people that we've housed in each of those years. The outcomes for the project for CHIP itself has been great. And remember, the number of people that we've housed also includes the clients from the encampments. So, the permanent supportive housing outcome was that 80% of clients remain housed 6 months after exit. So far, 100% have remained housed. 98% of clients remain housed or remain in permanent housing or after exiting rapid rehousing. 80% of diversion clients do not enter the homeless response system, so we're at 83% right now. Diversion has been a really interesting animal for us. Some of the things that we thought were going to happen ended up not happening, or vice versa. So it's been a great learning opportunity for our continuum of care. And then talking about this number of time from referral to lease up. So we track this. We've tracked it from the very beginning of when coordinated entry started, when it would take over a year to house someone. And then right before the pandemic, it was taking close to 90 days from the point of referral through coordinated entry until someone moved in. With CHIP, we were able to get that down to just over 30 days. But one of the things that we also noticed is that the unit acquisition and holding fees have had some effect on equalizing time to housing across racial demographics. So in the old way, we would, someone would go, if I'm a homeless client, I'm going with my case manager to various landlords and I'm applying in person, probably to be told no because I have a criminal background or because I have evictions or bad credit. And so the process, I would have to do this several times before someone would accept me. Inevitably, the landlord would have some bias on that individual, either because of their behavior or just because of the fact that they're homeless. There's negative connotation around that, the way that they look. But with the landlord engagement process, the individual really never sees the landlord. All the landlord ever sees is an application on a piece of paper. They don't see who the person is, how their behavior is, what they look like or smell like. And so the person meets the landlord on the day that he or she is signing their lease. So you can see that the number of days before CHIP and after CHIP. So for individuals identifying as Black or African American, it was taking 72 days to house them. It's now taking 36 days. For white, non-Hispanic, it was taking 66 days. Now it's taking 37. And then for Hispanic and Latino, it was taking 63 days. And now it's taking 32 days. So it's really not just because it has really sped up the process itself and eased up the backlog of not having units available, but also, it's helped on an equity standpoint as well. And then I also wanted to point out that our landlord engagement team, we've housed so many people that our landlord engagement team has probably recruited about close to 4,000 units at this point. But the majority of people that we've served through CHIP up until now have been single individuals. And so, sorry about that, my dog is barking, have been single. And so what has happened is that we've actually run out of one bedroom units. And so we've actually some of the units, some of the apartment complexes that we're dealing with had so much vacancy, and now they have no vacancies. So some of the properties have actually been sold because they've had, they're, and so it's gotten to the point where we're kind of running low on one bedroom units, and we've had to create a work group with both city and county funders to help us get over that. Try to kind of figure out some strategies around how can we increase the availability of one bedroom units at this point. So that's kind of where we are with that. The last thing I wanted to mention before we wrap up is that, with all of the ARPA that came out, we are kind of moving into CHIP phase 2. It's all part of CHIP, but we are using the emergency housing vouchers now to house individuals as quickly as we can. So all of our emergency housing vouchers are for literal homelessness and domestic violence. It was a slow start, as I'm sure a lot of communities are, but we're kind of rocking and rolling at this point. So far, we've secured funding for the first year of what we're calling CHIP Phase 2, which is really just a continuation of CHIP, but it's services for those emergency housing vouchers. It's for permanent supportive housing navigation to be paired with the 1,000 emergency housing vouchers that are coming into our continuum of care. So we've started that process. We're housing people from encampments still with the emergency housing vouchers. Some of those people that we put in the bridge at the beginning of CHIP are also going on to emergency housing vouchers. And then we're using the services that we got funded from the county and the state and the city at this point to continue services, and then at some point we will put them, they will transition into a permanent supportive housing or rapid rehousing intervention. And then lastly, I just wanted to show this visual. It's just so crazy to me. This is our BBVA soccer stadium. The capacity is 22,000, and so that is how many people, or a little bit more people, that we've housed since 2012. So look at all those people there, and it's just my coworker Jessica put that in there, so it's a really great visual to show how many people we've housed. So that is all we have for today. I really appreciate y'all giving us some time. If you have any questions, we are happy to answer them. I'll hang around a little bit so we can answer them in the chat. I also wanted to point out that the encampment response manual that's being shared nationally is in the material list that Craig put on there. The slides are in there as well. Our 5-year strategic plan is in there. And then we just closed last week, or the week before Thanksgiving, our largest, one of our largest encampments downtown. And it was featured in the Houston Chronicle, a great story that came out. So that is the full text that you see there at the bottom. And then, of course, I will try to find the information about the landlord engagement. We do have a landlord engagement page on our website. If you go to homelesshouston.org/CHIP, there is a section there for landlords, and there is a full, I believe, a packet of information that you can look through if you're a landlord and you're interested in that. Thank you. Can you?
All right, let me take us into the final room. Let me add that link in so we have that for everybody else. I looked on the website. I couldn't find the exact toolkit, but I just briefly looked, so I probably may have just looked over
Let's
it.
see. So if you click on where it says Get Involved Property Managers, it's in the middle of the page. And then, yeah, there you go. Thank you. And then there's a landlord information form. And then it talks about the CHIP housing plan. And then if there's any property managers that are interested and have one bedrooms, it talks about that as well. There were a couple of questions. Let me get to them real quick. So diversion. We actually got some trainers from LA to train us on how they do their problem solving conversations. So we tweaked. We got a work group in place, and we tweaked our coordinated entry process to figure out what the cutoff was before rapid rehousing, but not homelessness prevention. So what we came up with is if the individual has to leave where they're staying, that they don't have to be a leaseholder. So if the individual has to leave where they're staying within 5 days, then the coordinated entry process will push them to a diversion referral. And so the diversion referral gets sent to one of the diversion partners, and then they'll start the problem solving conversation. And that can include, it can be a bus ticket home to connect with your family members. It can be rental assistance. It can be, I just got a job. I'm able to pay my rent, but I need a deposit to move in. I need furniture. They could take part of our, CHIP furniture, because we do furniture for everyone that's moving into permanent supportive housing and rapid rehousing. It can be, work clothes. It can be storage. It can be car repairs. Pretty much, we did it to where some of our partners were funded from government dollars, from federal dollars. But then we have one partner that was funded with some private funding, so we could try to be a little bit flexible. But we had a lot of great technical assistance through our TA provider in the beginning, and they did a lot of research on what CDBG and ESG CV funds could cover, and really they can cover almost everything aside from a very, very few things that private dollars can. Let's see. I think that is it.
Yeah.
Sheriff's teams balance
yeah.
enforcement of the new no camping law versus working with them. I know encampment decommissioning is part of that, but how do they separate those duties?
So, I don't know. You want to speak to that? Can you speak to that, James?
Yeah, I mean it's very it's difficult because, like you said, it's kind of now it's law versus us working together to end homelessness. But I think what I've heard our city homeless liaisons that we work with say is that they feel like they are addressing the law and following the law by engaging through hot teams and coordinated access and working with the encampment decommissioning with us, because we, based on resources available, we're the ones who are helping them prioritize which location is next. And so since those locations aren't sanctioned, we are effectively kind of prioritizing each location to decommission. So it's nuanced. It's definitely not black and white, but they kind of see their work and what they're doing as addressing the law.
Kind of already on our radar anyways, because if you'll look through the slides, you'll see the section, and even in the encampment response manual, you'll see that some of the vulnerability factors that we look at when we're targeting an area to decommission, but all of the vulnerability factors apply to those locations already, and so it's really a no-brainer. I think that is it. Did I miss any questions, Craig?
I just scanned. I didn't see any new ones. We do have till 2:30, so if there's no other questions, y'all are going to have 33 minutes of your own private time back to your life.
Thanks, everyone, and please reach out.
Let me jump
my
in.
email is at the very end. Questions, please shoot me an email, and we're happy to help in any way. Thank you so much. We appreciate you.
Thank you, everyone.
I just want to say thank you to you two. I appreciate you taking your time to share your information with us. I know we're not as big as Houston, but I think we can use some of the lessons y'all have learned definitely down here.
We're all Texans. We're all Texans. Thank you.
Yeah. Thank y'all. All right,
Bye.
signing off. I will get the recording posted as soon as I can, y'all.